Hi everyone, I'm Eliezer Culasing from section BSN 1C. And in this video, I'm going to go over the nursing assessment of cranial nerve. Cranial nerve tests will help you assess the neuro of your patients. Each test is designed to target a specific cranial nerve. So let's get started. The first nerve that I'm going to test is the cranial nerve 1 or the olfactory nerve. I'm going to make the patient close her eyes, then I will tell to smell something and guess it. For the cranial nerve 2, I'm going to do two tests here. The confrontation visual field and the visual acuity. First is the confrontation visual field. I will let the patient stand and tell her to close her right eyes with her hands, and she will tell how many fingers can she see and do it again with her left eyes.
2 3
Left, 3.
3 2
Now, let's test for the visual acuity. I'm going to place the chart 20 feet away from my patient, then I will let her read and see what line can she read with her right eye, left eye, and both of her eyes.
D E F G O D E C D E F G O D E C D E F P O D E C.
She can read at line 8, so that means that she has 20/20 vision. Next thing that I'm going to assess are the cranial nerve 3, which is the ocular motor, the cranial nerve 4, which is the trochlear, and the cranial nerve 5, which is the abducens. The first one that I'm gonna do is to look for involuntary shaking of the eye. I will tell to the patient that she will just follow the object with her eyes only. Next, I'm gonna see how reactive pupils are to light. And to do that, we will be needing a pin light. I'm going to check if the pupil will constrict. The pupil constricts. Let's go to the left eye. And it constricts. Next one that I'm gonna do is to check for accommodation. I'm going to slowly move this pin light toward her nose, and we will see if the pupil will constrict. We can conclude that pupils are equal, round, and reactive to light. Now, I'm going to test the cranial nerve 6, which is the trigeminal nerve. I'm gonna tell the patient to bite her teeth, then I'm gonna feel the muscle right here and then feel the muscle right here. Next, I'm going to test nerve that help her open her mouth against resistance. Next that I'm going to test is the cranial nerve 7, which is the facial nerve check. I'm going to tell the patient to do what I'm gonna say to her. In here, I said to her that she will close her eyes and open her mouth at the same time. I also tell to her to smile. She did that easily, so that means that cranial nerve is intact. Next, I'm going to test cranial nerve 8, which is the vestibulocochlear nerve. In this test, I'm going to close one of her ears, then I'm going to whisper words on the other side of her ears. Then she will gonna say what I've said.
Mobile Legends. League of Legends.
Next one that I'm going to assess is the cranial nerve 9, the glossopharyngeal nerve. I'm going to tell the patient to open her mouth and say ah, and let's see if the uvula will move up. There it goes. Next is the cranial nerve 10, which is the vagus nerve. In here, I told the patient that she will talk and try to swallow. And we can conclude that vagus nerve is intact because she is able to talk to me and she is able to swallow. Next is the cranial nerve 11, which is the accessory nerve. In here, I'm going to tell the patient to move her head side to side, up and down, and try to shrug against my resistance. She did it, so the nerve is intact. Next one that I'm going to do is to assess cranial nerve 12, which is the hypoglossal nerve. I let the patient stick out her tongue and move it side to side. And she did it. So that means that cranial nerve 12 is intact. So that's how to perform a nursing assessment on the cranial nerve. Thank you and God bless.